standpoint for how we move forward with the discussion around behaviors. Because I think that at times, and I certainly in my experiences, especially working with people with dementia, staff in long-term care, that we tend to focus on the behavior itself, rather than what we really should be doing is focusing on the person and who that person is and how we can better meet that person's needs. So a lot of work that we've been doing for a number of years, and this isn't just MAREC, this is in general, just looking at how we can provide education and support for family members, for staff working in long-term care, day programs, or any kind of home settings, is we try to set up some kind of framework to get us started in trying to figure out what is happening for that person so that we can better support them. And we sort of use, we kind of look at them in three sort of steps. And the first thing is asking ourselves, what is happening? What is happening right now in this moment, or what have I been seeing over time? And trying to understand the possible causes of what is happening. And I'm going to touch on that in the next slide. The other two questions that we really want to ask ourselves is, who is this affecting? And who needs to be involved? It's not just that person, or there's a whole group of people that are affected at times when someone is expressing themselves. Other family members, teachers, care providers, peers. So who is this affecting and what are the risks involved? Because we want to make sure that everybody in the equation is safe to the best of our ability. And then from there, talking about how we move forward. How do we create strategies that are really going to work for everybody? Okay, so the first question, what is happening, and understanding the possible causes and triggers. This, is foundational to trying to better understand responsive behaviors. About over 12 years ago now, there was a lot of work done in Ontario to help develop a framework for families and staff to look at what could be causing our responsive behaviors so that we could better support the person. And so what was developed was what they call PIECES. It's an acronym, and it's listed up there. It stands for Physical, Intellectual, Emotional, Capabilities, Environment, and Social and Cultural. So basically what this framework was developed for was to help us to look at, take a holistic view. It's not just about what's happening medically, but let's take a step back and look at the big picture of what's happening in the environment for that person, and what could possibly be causing what is happening. So when we look at physical, we're looking at medical factors. What has changed? Is there something that's changed? For older adults, the two big factors when we look at physical is pain and infections, like urinary tract infections. Those things can really cause a sudden change in a person's ability to navigate their environment. It may not necessarily be the same for your loved one, but you know your loved one best. Sleep, hunger, hearing, eyesight, all of those things, all of those physical things, flu, cold, headaches, all of those things that could be possibly impacting that person. Is that possibly contributing to the situation that you're encountering? The next is intellectual, and so this is what is happening physically in the brain as a result of the dementia. And so we know that there are a lot of changes that are happening. Communication changes in movement and ability to follow instruction. There's a lot of changes that are happening. And so are those in some way contributing to this factor? Often they are, but sometimes it's not just that. The next thing we look at is emotional. What is emotionally happening for this person? We often look at, for older adults, we often look at mood or such as things like depression. We look to those things as well as just the emotional stability of the person. How are they feeling? Have they gone through a recent change or transition that is maybe causing some of these changes? We often give the example of, sorry, I'm just looking at my notes. I realize they're 8-point font, so I'm having trouble reading them. So one of the other things is fear. So we look at under emotionally, is this person scared or fearful? What is happening in the environment that might be causing fear? The example that we often give is for a person in long-term care, in their room, if a staff person comes in and starts undressing them, how would you react? You probably would try to protect yourself, right? Fight or flight response. That's something that stays with us. And so we are trying to protect ourselves. And so we want to look at what possibly could be the emotional contributions to what we're seeing. The next one is capabilities, and I feel this one is a really important piece because we often talk about what is missing, what has been taken away from that person because of dementia. And what we really are trying to do is focus on what are the continued strengths and skills and abilities that your child still has. Are they being asked to do things that are too difficult for them? Are they overwhelmed? Are they asked to do something that is too easy for them and they're bored? These kind of things can contribute to a person responding in behaviorally. So we really want to look at strategies like breaking down tasks or making sure that the tasks are, looking at the success for that person. The next thing is environment. And so again, it's about responding to what is happening in the environment, a responsive behavior. So what is happening in the environment that could be contributing? Background noise. Something like, the beeping of, the cell phone rang and you know how sometimes it beeps to let you know that you missed a call. Well, those kind of things can trigger individuals, because we want to remember that with any type of dementia, the filter, our ability to filter noises and sounds is not working the same way. So what might be a very simple sound to us that we can filter out, that person may not be able to filter the same way. Lighting is another area to look at. Are things too dark? Are things too light and causing shadows? Those kind of environmental factors. And lastly, we want to look at social and cultural factors. Who is your child? What are their interests, their hobbies, their likes and dislikes? Are they an introverted person or a more extroverted person? And who are the important people in their lives? We don't want to forget about those types of things when we're trying to determine what could be possibly causing the response that we're receiving from our loved one. So then it comes to, and I realize I don't have a screen back there, but I'll just keep it going if that's all right with you.